So I wanted to come and I wanted to myth bust about VOs. A VO is known as a vascular occlusion. A vascular occlusion is considered one of the biggest emergencies within aesthetic medicine. When I consider an emergency, I consider things like cardiac arrest, like heart attacks, where somebody's life is in immediate danger. When it comes to a VO, your life isn't in immediate danger. It's something that needs to be resolved in a timely fashion, but it's not something that is going to kill you there and then. Therefore, is it an emergency? And is there a lot of fear mongering, a lot of scaremongering on the internet to put fear in people that are going to undergo treatments? So, what is a VO? A VO, in theory, is defined as the partial or full obstruction of a blood vessel. And this would be, in layman's terms, me putting a small amount of filler accidentally into one of your blood vessels, which means that blood cannot flow through sufficiently or fluidly, and therefore you get tissue damage or oxidative damage to the vessel that's obviously obstructed, and then the surrounding tissue doesn't get the nutrient supply that it needs, and then there is a cascade of very nasty events. However, it is time sensitive, and that means that even though it's something that needs to be treated pretty quickly, it doesn't mean that you are going to die a death. This is not a medical emergency. It's just a very unfortunate event that happens when you are having these kind of treatments. And it's not about the event happening, it's about how that event is managed. So I'm a practitioner that's worked for over nearly 10 years and I've done multiple treatments. And what I would say is I have caused VOs. That doesn't mean I'm a bad practitioner. It means that I see a high number of people and I do not have x-ray eyes. I can't see into the skin. I can't see where those blood vessels are. I have a very good anatomical understanding, but that doesn't mean I can see. It means I can assume. So if it happens, it's unfortunate, but it's about how that situation that occurs is then managed by your practitioner. It's not about being blocked and deleted. It's not about sending you to A&E. It's about ensuring that you feel confident, that you feel in safe hands, and that the issue is resolved in a timely fashion. And also that you understand as clients that this can happen and you aren't exempt from it. If you've had treatment in the past and it's never happened, it can happen to anyone at any time by any practitioner. You know as a client that you're now going to have that filler potentially dissolved, and your practitioner knows that their day is affected. Also, there is an element for a practitioner that you feel like you've done something wrong. You have to take a real deep breath. And let me tell you, as a practitioner that works by themselves, I never manage a VO by myself. I will always ask advice because there is always something or someone else's opinion that will be valid in that situation. I don't know everything, so it's important to reach out to your peers. Ultimately, having a VO in clinic is a pain in my ass, a real pain in my ass. I do everything I can to prevent it from happening, but occasionally it's just beyond my control. So when it does happen, I will fix it, I will deal with it, and I'll make sure that my client and I feel as safe and as sort of protected in that situation as physically possible. So if you are in that situation, particularly with me, and you see that I'm then ringing someone for advice, it doesn't mean I don't know what I'm doing. It means that two heads are sometimes better than one. The main aim with a VO, if it occurs, is to then treat it so that we can get blood back to that tissue. And we want to do that quickly, as I said. However, it can mean that you have to come back to clinic a few times. It can be a bit of an inconvenience. But let me tell you, you'd much rather have it treated than left. So, does it mean that a practitioner that causes a VO doesn't know anatomy? Absolutely not. Does it mean they're a bad practitioner? Absolutely not. Does it mean they don't know what they're doing? Absolutely not. A bad practitioner or somebody that doesn't know what they're doing is likely to block and delete you and to send you to A&E. A good practitioner will reassure you. If they think that it's above their sort of area of treatment, they will refer you on and they will be in constant communication to make sure that you're okay.